Today marks the end of the Ebola outbreak in Uganda, 4 months after the first cases were reported. I congratulate the government, the people of Uganda, and health workers, some of whom lost their lives for their leadership and dedication in bringing this outbreak to an end. And we thank donors and partners for swiftly mobilizing resources and vaccine developers for making candidate vaccines available in record time. Even in the absence of approved vaccines or therapeutics for this type of Ebola, Uganda was able to use proven public health tools to contain the outbreak. It's now 3 years since the first sequence of SARS-CoV-2 was shared with the world. That sequence enabled the development of the first tests and ultimately vaccines. Throughout the pandemic, testing and sequencing helped us to track the spread and development of new variants. Sequencing remains vital to detect and track the emergence and spread of new variants, such as XBB.1.5. We urge all countries now experiencing intense transmission to increase sequencing and to share those sequences. Investment in testing at-risk people to ensure they receive adequate care and in tracking the virus remains vital. During the last 6 months of last year, people aged 65 or over accounted for almost 90% of all reported deaths. But once again, the data we receive from countries is inadequate to give us a clear picture of who is dying and why. Only 53 out of 194 countries provide data on deaths that are disaggregated by age and sex. As we enter the 4th year of this pandemic, we ask all countries to provide this data. The more data we have, the clearer a picture we have.
WHO still believes that deaths are heavily underreported from China, and this is in relation to the definitions that are used, but also to the need for doctors and those reporting in the public health system to be encouraged to report these cases and not discouraged. However, having said that, we do, as Maria said, want and are working ever closer with our colleagues in China to try and understand better the transmission dynamics. But we still do not have adequate information to make a full comprehensive risk assessment, and therefore we will continue to try to encourage access to that data. China has done a lot in the last number of weeks, particularly to strengthen its own internal capacities to serve the clinical needs of its own population in terms of expanding hugely the number of designated hospitals, ICU beds, fever clinics, in adapting the clinical management pathways to include earlier diagnosis, the prioritization for diagnosis for people with vulnerable underlying conditions with older age, and prioritizing the use of antivirals early in the course of disease.
Omicron variant of concern has been circulating for more than a year now. And as we've mentioned, there are many sublineages that we're tracking. The assignment of the Greek letters was a way in which would help us to be able to publicly communicate differences in viruses that are circulating, and assigning that name, meaning that these viruses had different characteristics than the previous variants of concern. All of the subvariants of Omicron are behaving very similar to one another in the sense of their transmissibility, their severity, their immune escape, and the impact of our interventions. When that changes, we will be using these Greek letters. In the community, for the general public, WHO does recommend the wearing of masks when you're indoors, when in particular when there's crowding, when ventilation is poor or you don't know what the ventilation is. And that can include a variety of different types of settings like public transport, but can also include buildings. We're in a room right now where we have very good ventilation, we're distanced apart, and so context is important.
Since January of last year, 31 countries have reported outbreaks, 50% more than in the preceding years. The outbreaks themselves are both more widespread and deadly than normal. While we have had large cholera outbreaks before, we have not seen such a large number of simultaneous outbreaks. The common denomination for many of these outbreaks is climate-related events such as storms, floods, and droughts. Haiti, Malawi, and Syria are among the worst affected countries. In the past few weeks, 4 more countries requested vaccines, which are extremely scarce. With increasing number of outbreaks that are larger geographically and in number, we call on countries that have experienced cholera outbreaks before to increase preparedness for potential outbreaks. We thank EU Biologics, based in the Republic of Korea, for maximizing production and for its efforts to develop a new vaccine with the potential for larger production. We continue to call on other manufacturers to do the same.